All right, let's dive right into this. Welcome to today's explainer. If you're looking to really understand the mechanics, the history, and the ground reality of one of the world's most notorious viruses, you are in exactly the right place. Today, we're taking a close look at Ebola virus disease, or as most of us know it, just Ebola. It's a severe, very often deadly infectious disease that primarily hits humans and non-human primates, like monkeys and chimpanzees. Our goal today? We're going to completely demystify this disease. We'll start way down at the microscopic level of the virus itself and build all the way up to the massive global public health response.
So, here is our roadmap for the explainer. First, we'll trace the origins of Ebola. Second, we'll look at how the virus actually spreads. Third, we cover symptoms, diagnosis, and treatment. Fourth, we'll examine the human and global toll. And finally, we'll wrap up with prevention and public health.
Let's get right into it with Section 1, the origins of Ebola.
So, where did this all start? Well, Ebola wasn't actually officially identified until 1976. This happened during two simultaneous outbreaks right in the heart of Central Africa. One was in present-day South Sudan, and the other was in the Democratic Republic of the Congo, specifically right near the Ebola River, which, you guessed it, is exactly where the disease gets its name. Scientists pretty quickly realized they were dealing with a completely unknown virus. Now, fast forward a few decades, past some outbreaks in places like Uganda, and we hit 2014 to 2016. This was literally the largest Ebola outbreak in history. It ravaged West Africa, mainly Guinea, Liberia, and Sierra Leone. Thousands of people tragically lost their lives. And because infected travelers inadvertently carried the disease across borders, it triggered immense, incredibly urgent global concern.
Okay, so what is this thing biologically? The Ebola virus belongs to a family of viruses called Filoviridae. And get this, scientists believe the natural hosts of the virus are actually fruit bats. The bats act as reservoirs, meaning they can carry the virus around without actually getting seriously sick themselves. Now, there are 5 distinct species of the Ebola virus. They all belong to the same family, but they are absolutely not equally dangerous to humans. It is really important to highlight the Zaire Ebola virus here, because that specific strain is the one responsible for the absolute deadliest outbreaks we've ever seen.
Moving right along, let's look at Section 2, how the virus spreads.
We are all so incredibly used to airborne viruses, right? Things like the flu or COVID-19 that literally just travel through the air. Well, Ebola does not do that. It is strictly a fluid-borne virus. It spreads exclusively through direct physical contact with infected bodily fluids. Honestly, dispelling that myth that it somehow floats through the air is the absolute first step in properly understanding your actual risk.
So how does it actually jump from person to person? A person becomes infected through direct contact with blood, saliva, vomit, sweat, urine, feces, breast milk, or semen. It can also spread by touching contaminated surfaces or by handling those infected animals we mentioned, like bats or monkeys. And human-to-human transmission is incredibly high risk in a few very specific scenarios. For instance, healthcare workers face immense danger if they don't have the right protective equipment. Sharing contaminated needles is another major vector. Also, traditional burial ceremonies that involve touching the body of the deceased, those carry exceptionally high infection risks. And extending even beyond the immediate illness, sexual contact with survivors can actually transmit the virus long after they've recovered.
All right, Section 3, symptoms, diagnosis, and treatment. Let's talk about what happens when the virus actually enters the human body.
Take a look at this time frame, 2 to 21 days. That is the incubation period. And honestly, it's what makes this disease so incredibly tricky to track and catch early. A person could be exposed to Ebola and then just go about their normal, everyday life for up to 3 weeks before showing even a single sign of illness.
But once it starts, the illness evolves rapidly and fiercely. It usually kicks off super suddenly with severe flu-like symptoms. We're talking high fever, muscle pain, a brutal headache, and intense fatigue. But as the disease progresses, this terrifying cascade begins. Patients develop severe gastrointestinal issues like intense vomiting and diarrhea. You see skin rashes, red eyes, and difficulty breathing. And most dramatically, it can lead to internal and external bleeding, like bleeding from the gums or the nose. In the worst cases, this horrific cascade leads to organ failure, shock, and tragically, death.
Now, here's a huge problem. Because those early signs, the fever, the fatigue, the headache, so closely resemble other common diseases in the region, like malaria or typhoid, doctors literally cannot diagnose it just by looking at a patient. They rely heavily on precise laboratory tests. Techniques like PCR, that's polymerase chain reaction, alongside antigen detection and very specific blood tests are absolutely critical. Confirming that diagnosis quickly and accurately in a lab is really the only way to make sure the patient gets the right care, while at the same time preventing the accidental spread of the virus to everyone else in the clinic.
So, what if that test comes back positive? What are our medical countermeasures? Well, while there isn't some simple universal cure for Ebola just yet, treatment has improved vastly over the years. The primary strategy right now is aggressive supportive care. Doctors use oral or IV fluids and electrolyte replacement to stop the severe dehydration caused by all that vomiting and diarrhea. They provide oxygen therapy, pain medicines, and they jump on any secondary infections. Plus, modern medicine has made some massive leaps forward recently. Certain antiviral medications and monoclonal antibody therapies have shown real, genuine effectiveness against specific strains of Ebola. The big takeaway here? Getting early medical care massively increases a patient's chances of survival.
Which brings us to Section 4, the human and global toll. Let's zoom out a bit.
An Ebola outbreak creates this incredibly devastating socioeconomic ripple effect. Way beyond the tragically high death rate, this virus practically cripples local and national economies. Trade and tourism just plummet, schools and businesses are forced to shut their doors, which grinds daily life to a total halt. Healthcare systems become completely overwhelmed, sending costs through the roof. And on a deeply human, emotional level, it fractures societies. It leaves behind orphaned children, severe community disruption, and this profound, lingering sense of fear and stigma long after the outbreak is supposedly contained.
And, for the survivors who actually pull through, the battle isn't really over. They frequently face really severe long-term complications. We're talking about lingering physical ailments like joint pain, extreme weakness, and even eye problems. They also battle memory difficulties and, totally understandably, severe psychological trauma. Plus, there's a crucial biological detail we have to remember. Even after a patient has recovered and is feeling totally fine, the virus can actually remain hidden in certain body fluids for months. That requires a lot of ongoing caution and continuous medical monitoring.
Finally, let's move to Section 5, Prevention and Public Health, and look at how we fight back. So the crucial point here is understanding the actual engine of public health control. It basically happens in these 3 distinct steps. Step 1 is disease surveillance, meaning we're always watching, always testing, and always ready for a case to pop up. Step 2 is rapid patient isolation. The exact second a case is identified, that patient has to be safely separated from the public so they can get care without spreading the pathogen. And step 3 is contact tracing and quarantine. This is where investigators track down literally every single person the patient interacted with while they were contagious, and they monitor or quarantine them until that 21-day incubation window passes. This sequence right here, this is what stops an outbreak from blowing up into an epidemic.
On the ground, prevention is intensely practical. It's about wearing protective clothing like gloves and masks, washing your hands constantly, and rigorously sterilizing all medical equipment. Public education is absolutely vital too, teaching communities about the safe handling of dead bodies and why it's so important to avoid bushmeat from infected animals. But the absolute biggest game changer we've seen recently? Vaccination. Scientists have successfully developed vaccines specifically targeted against that highly lethal Zaire strain, and it has drastically helped control recent outbreaks in Africa. When you couple that with the rapid response of international groups like the World Health Organization, our collective ability to intervene and save lives has just improved exponentially.
Which leaves us with this final thought. Ebola is a devastating, incredibly complex threat, but as we've seen today, it is a threat we are learning to counter with awareness, rigorous hygiene, early diagnoses, and targeted vaccines. But let's be real, the battle against infectious disease never truly ends. So, given everything we've just covered, from those swift isolation protocols to the absolute vital importance of community trust, how can the public health lessons learned from fighting Ebola prepare us for the next unknown global pathogen? Really think about that as you process what we've covered today. Thank you so much for joining me for this explainer. Stay curious and keep learning.